Welcome. Continuation of pathophysiological aspects of totality. Inflammation is one of the commonest accompaniment of any disease process or most of the diseases, whether acute or chronic. So that form, one of the aspects to be considered in totality. From homeopathic standpoint, inflammation, will have different phases which can be considered. For example, congestion, where increased blood supply occurs. Next stage may be the catarrhal process, which occurs mostly at the site of mucous or serous membrane with lot of discharges, and that forms, of course, the inflammation may proceed to that. It may occur that it goes to the stage of suppuration with the pus formation, or in certain cases there may be ulceration, the fistula formation or the sinus formation. So all these the stages are different and therefore important to note down from differential point of view to find out the individuality of a case. Of course, after the inflammatory process is over, healing occurs, which may be just normal, or sometimes unhealthy healing may give rise to what we call as the scar formation. So that also is to be considered, whether the healing is healthy or unhealthy. It is possible that 2-3 phases or 2-3 components of this inflammatory process will be there in the patient together. In that situation, whatever component or the phase is dominant you consider, that is to be taken into account when we form the totality. For example, it may be suppuration which is more, or it may be suppuration may be minimal, but what we call as the fistula formation may be there. So depending on that, what is dominant, that particular aspect is to be noted down carefully. Next consideration or the element or the point to be considered in totality is sensitivity. Now sensitivity from homeopathic standpoint, one way of looking at it is excessive response to any sensory inputs. For example, if you touch certain individuals, they will just startle. Or there will be another person, there is a group of people and he is also there. Once entering the room, that particular gentleman smells something which others cannot. That means his sensitivity or his acuteness of what we call as the sensory apparatus, sensory input, that itself is a peculiarity, individuality of a patient, and that is to be noted down. Another way of looking at sensitivity is, of course, what is generally called as deviations in the immunological system. Immune response, of course, as we all know, that it is a natural response of the body to, you may say, any injurious agent. It's a protective response. But it may, if it is altered, it may be little less, it may be excessive, or it may have a deviation, what we call as the aberrant immune responses. And all these responses, they are different. For example, now deficient response, immunological response, it may be manifested in diseases like severe congenital neutropenia or hyper IgE syndrome. But besides these diseases, we also find in practice, for example, in children, the immunological mechanism is not well developed, so the response may be deficient, and they may fall prey to recurrent infection. Or sometimes we find in any individual, it may be that after severe acute infection or any after acute disease, his immunological responses may be little less. So And all these what we call as the deficient immune response, the technical term which is used by homeopathic physician is poor reaction. You will find this word in repertory as well as in Matra Medica. The response may be excessive, represented by what we call as allergic responses, which is allergy is very common on the skin as well as on the respiratory tract, like bronchial asthma, or on the skin urticaria. We have studied those cases. So these are all allergic manifestation, excessive response, excessive immunological responses. There may be aberrant response. Now, what do we mean by aberrant immune response? Especially this disease is more common, especially in the age group of say 7 years onwards. The child may have streptococcal sore throat, streptococcal infection, and suddenly the infection will travel, or not exactly infection, but there may be manifestations on heart or maybe in the joint, what we get in the rheumatic fever. So the infection is there, but the manifestations are where the what we call it at very different places. So these are called aberrant immune responses. Another variety which is very important, which is very common, what we call as autoimmune diseases. Autoimmune diseases. For example, rheumatoid arthritis or SLE, and there are many. So these are all responses which are aberrant immune responses, and these are all separately to be considered because that indicates individuality. So this is about the pathophysiological aspects of inflammation and sensitivity. Next time we'll continue with the subject of study of patient with respect to pathophysiological aspects of totality. Thank you.